The normal movements of the eyeball are controlled by muscles referred to as extraocular muscles. And these extraocular muscles are supplied by some important cranial nerves. When these cranial nerve gets injured, it often results in paralysis of extraocular muscles, leading to abnormalities. One of such abnormality we can see in this image. What we see in this image is abnormal positioning of the eyeball on the left side. So these extraocular muscles not only control movement of the eyeball, they also make sure that the eyeballs stay in normal anatomical position. The nerves which are responsible for controlling the movement and the normal position of the eyeball are three important cranial nerves. And in this session, we will focus on the anatomy of these three important cranial nerves, that they are oculomotor, trochlear and abducent nerve, the third, fourth and the sixth cranial nerves. The learning objectives for this session will be, at the end of this session, you should be able to describe the oculomotor, trochlear and the abducent nerve under following headings. What are they? They are the introduction, where you describe the number of cranial nerve and the function type. Then the functional components, what functional components are present in it. The deep or nuclear origin, the superficial attachment or the superficial origin. Then we have the course and relations, in which you will describe it under intracranial and extracranial course. Then branches and area of distribution. And finally, we will discuss about the clinical conditions associated with these nerves. Let's begin with the detailed anatomy of the third cranial nerve or the oculomotor nerve. Just a few lines about the introduction to oculomotor nerve, called so because it brings about the movement of the eyeball. It supplies almost all the muscles of the eyeball except for superior oblique and lateral rectus. Oculomotor nerve is the third cranial nerve and it is a pure motor nerve. It has no sensory component, right? And the reason why it's called so, because it supplies almost all the extraocular muscles, leaving out the lateral rectus and superior oblique. Hence, this is the chief nerve responsible for the movement of the eyeball. That's why it's called as oculomotor nerve. Let's see what type of cranial nerve is it and what functional component it contains. As we discussed earlier, the oculomotor nerve is an example for purely motor nerve. Once we say it is purely motor, we can rule out all four afferent components. So this should have any one or all three of efferent components. First, try to list the efferent components. The efferent components are general somatic efferent column. Then we have special visceral efferent column and general visceral efferent column. As we know, general somatic efferent column will supply skeletal muscles derived from cranial somites. All extraocular muscles are derived from cranial somites, and hence there is a general somatic efferent component in oculomotor because it innervates almost all extraocular muscles. Special visceral efferent column supplies muscles derived from branchial arch. Oculomotor nerve, apart from supplying extraocular muscles, will not supply any muscle derived from branchial arch. So there is no special visceral efferent column. What about general visceral efferent column? Will oculomotor nerve supply any cardiac muscle, smooth muscle or gland? Remember, there is a component from oculomotor nerve which will supply constrictor pupillae, which is one of the smooth muscle present in the inside of the eyeball. And hence, there is a general visceral efferent component. So, oculomotor nerve is a purely motor nerve and it has two functional components. General somatic efferent component which will supply the extraocular muscles, the general visceral efferent component which will supply sphincter pupillae. Right? Once we have learnt about functional components, what about the nucleus? Since it has two functional columns, there must be two nuclei associated with it. First, let's try to learn where exactly is the location of these nuclei. Right? These nuclei are present in midbrain. So what you see in the image, this is a section of the midbrain. Within the midbrain, there are two important nuclei. Now what are these? One is the motor nucleus and the other one is referred to as the Edinger. It is known as Edinger-Westphal nucleus. So Edinger-Westphal nucleus and motor nucleus, right? So here we have the motor nucleus and here there is Edinger-Westphal nucleus. And from these we have different fibers. The function: motor nucleus will supply all the extraocular muscles. Edinger-Westphal nucleus is concerned with supplying sphincter pupillae. Right? So this is regarding the deep origin or the nuclear origin. Then, what about the superficial origin? We need to know where exactly it is attached to the inferior surface of the brain. Again, before we do that, let's identify the parts of brainstem. This is the region of front of the midbrain. This is pons, and we have the medulla oblongata. Right? Now, oculomotor nerve is attached to midbrain. If you write the course of the oculomotor nerve, this is how the oculomotor nerve will course through. It arises from ventral surface of midbrain. That's all you need to know regarding superficial origin. Right? Fine. What about its course and relations? Remember, the course and relations we can always discuss under two headings. What are they? Intracranial and extracranial. Right? The intracranial course of oculomotor nerve begins from its origin at the ventral aspect of the brainstem. So this is the section of midbrain and this is the ventral part. So oculomotor nerve is arising from the ventral part of midbrain. After that, one important relation it presents is it passes between two blood vessels. Right? Now this is the superior cerebellar artery and this is posterior cerebral artery. Both oculomotor nerve and trochlear nerve will pass in between these blood vessels. This is one important relation you must remember and write in your exam. Even this is asked plenty of times in your entrance exam. This relation to the two blood vessels. Right? So oculomotor nerve, after it arises from ventral part of the midbrain, passes between the superior cerebellar artery and posterior cerebral artery. Then, when it passes forwards, it enters the dural partition and enters into one of the important dural venous sinuses. And what is that sinus? It enters the lateral wall of the cavernous sinus. If you remember the outline of the cavernous sinus, we have done this in the session of cavernous sinus. The medial wall of the cavernous sinus is related to the internal carotid artery and one nerve that is oculomotor, one nerve that is abducent nerve. Then the lateral wall is related to four nerves. These four nerves are oculomotor, then we have trochlear, then ophthalmic division and maxillary division. So this is the relation that we need to remember. Right? So oculomotor nerve, as it passes through the lateral wall of the cavernous sinus, it is the most upper structure or the superior structure. Right? Then once it leaves the cavernous sinus, it enters the superior orbital fissure and there ends the intracranial course. Once it enters the superior orbital fissure, it divides into two divisions. As we can see here, these are superior ramus and inferior ramus. Right? Now, once they enter superior orbital fissure, they will leave the skull through the superior orbital fissure. Which compartment? The intermediate compartment. Right? So, this is regarding the intracranial course. Once it exits the superior orbital fissure, then comes the extracranial course, and the extracranial course will supply all the extraocular muscles. As we can see, the superior ramus. Now, how do we identify superior ramus? Now, I would say this is the superior ramus because it is supplying two muscles, and what are they? This is the superior rectus and this is the levator palpebrae superioris. So, the superior ramus of the oculomotor nerve will supply these two blood vessels. Then, when we come to the inferior ramus, this is the inferior ramus. The inferior ramus will supply, what is this? This is the medial rectus muscle. This is the inferior rectus and this is the inferior oblique. Right? So, these are the muscles supplied by the inferior rectus. This is regarding the course and relations of oculomotor nerve. So, remember under these headings. Right? Once we know about the course and relation, regarding the branches, as we have already said, there is a superior ramus This is the superior ramus, and what is this? This is the inferior ramus. And we already discussed that the superior ramus will supply superior rectus, and what is this? Levator palpebrae superioris. Whereas the inferior oblique will supply medial rectus, then inferior rectus, and finally inferior oblique. The nerve to inferior oblique is peculiar because this will give a branch to ciliary ganglion. Fine. So this is regarding the branches coming from oculomotor nerve and the muscle supplied by it. As I said, this supplies almost all the extraocular muscles, leaving out only two muscles. One is lateral rectus and the other one is superior oblique. That is why it's also known as oculomotor nerve. What about the clinical anatomy then? If oculomotor nerve gets damaged, it leads to an array of clinical features. What are they? First is, it results in drooping of the eyelid, and what we call this? This is referred to as ptosis. Why this occurs? This occurs because of paralysis of what muscle? The levator palpebrae superioris, which is responsible for elevating the eyelids. Then, if you observe, because of the paralysis of what muscles? The extraocular muscles apart from lateral rectus and the other muscle is superior oblique, it would result in the lateral squint. Fine. You can see that the eyeball has moved to lateral side. Apart from this, there is one more important feature, that is dilatation of the pupil. Now, why dilatation of the pupil occurs? This is because of paralysis of what muscle? This is because of paralysis of the sphincter pupil. So, these are some of the clinical features associated with oculomotor nerve. Once dilated pupillae is unopposed because of the paralysis of the constrictor pupillae, it not only leads to dilated pupil, there is also little bit of loss of accommodation. Now, why this loss of accommodation occurs? Remember, loss of accommodation occurs because of involvement of medial rectus. Oculomotor nerve supplies medial rectus, and medial rectus is responsible for seeing the structures which are nearby. If you want to look at the tip of the nose, if you want to read something which is very close to your eyes, it is the medial rectus which will bring about the accommodation reflex, right? Bringing the eyeballs together. So once oculomotor nerve is paralyzed, apart from ptosis, the dilatation of pupil, one more important clinical feature you will get as loss of accommodation. Right? This is regarding the clinical features that can occur in oculomotor nerve palsy and the anatomical basis for these clinical features. Right? So once we have learnt about the anatomy of the oculomotor nerve, let's focus on the anatomy of trochlear nerve. Now, trochlear nerve is the fourth cranial nerve. Right? It is the fourth cranial nerve, and trochlear nerve has some peculiar features. Now let's try to understand what are the peculiar features of the trochlear nerve. So the peculiar features are, one, it is the smallest of all the cranial nerves. Fine. So remember this important point. Trochlear nerve is the smallest of all the 12 pairs of cranial nerves. Then, this is the only nerve which arises from the dorsal surface of the brain. Dorsal surface of brainstem. The second important peculiar feature, all cranial nerves starting from the 3rd to the 12th cranial nerve, all are attached to the ventral aspect of brainstem except for trochlear nerve. Then the third important peculiarity is, this is the only cranial nerve that undergoes complete decussation before it exits from the midbrain, the dorsal aspect of midbrain. None of the cranial nerves undergo such decussation within the substance of brainstem. This is the only cranial nerve that can undergo decussation before exiting the dorsal aspect of midbrain. So these are some of the peculiar features of trochlear nerve, right? Once we have learned this, let's focus on what type it is, and what are the functional components present in it. The trochlear nerve is also an example for a purely motor nerve. Whenever you have confusion regarding the type of cranial nerve, always remember the mnemonic to remember the classification of the cranial nerves as sensory motor or mixed. This is a purely motor nerve, so there is no question of 4 sensory columns. Again, there are 3 efferent columns that we need to write: general somatic efferent, then special visceral efferent, and general visceral efferent. The general somatic efferent column, as we know, supplies the muscles derived from cranial somites, which are extraocular muscles. Trochlear nerve, even though it's a big cranial nerve, not big since it is the smallest of the cranial nerve. Even though it is a cranial nerve, it supplies only one muscle, right? That muscle is the superior oblique, right? So the superior oblique is also developed from cranial somites, so it has a general somatic efferent component. Trochlear nerve will not supply any muscle derived from branchial arch, so it will not have a special visceral efferent column. General visceral efferent column. Will trochlear nerve supply any smooth muscle present in the eye or any gland that is present in the eye or around the eye? The answer is no, and hence it will not have a general visceral efferent column. So this is a lot easier. The only functional column that is present for trochlear nerve is the general somatic efferent column. Right? Let's try to understand which nucleus represents this general somatic efferent column. If we take a look at the brainstem, the location of the nucleus for trochlear nerve is in the midbrain. So what is this nucleus? This nucleus we refer to as trochlear nucleus, and where is it present? It is present in midbrain. And what functional column it represents? This represents the functional column of general somatic efferent fibers, which supply the superior oblique muscle, right? What about the superficial origin? Since the nucleus is present in midbrain, it should arise close to midbrain itself. But the peculiarity, remember here, is it arises from the dorsal aspect of the midbrain. Those dotted lines suggest that this arises from the dorsal aspect of the dorsal aspect or dorsal surface of what? Midbrain. Which is one more cranial nerve that is arising from midbrain? The oculomotor nerve. But it arises from the ventral surface. Dorsal surface would give origin to the trochlear nerve. As I said, remember, this is the only cranial nerve that arises from the dorsal aspect of midbrain. Right? Fine. Then let's try to understand its course. Again, the course can be divided into what? Intracranial and extracranial. Right? The intracranial course looks almost similar to that of oculomotor nerve. But what are the difference? As you can see, the two peculiarities you can note here. There is decussation of fibers. Right? One is decussation of fibers, you can see. And the other thing is the cranial nerve is exiting through dorsal surface. Dorsal surface of what? Dorsal surface of midbrain. After it arises from dorsal surface of the midbrain, the trochlear nerve winds around the lateral surface, then passes between two arteries. And what are those two arteries? One is the superior cerebellar artery. And what is this? This is the posterior cerebral artery. Right? After that, it enters and passes through the lateral wall of cavernous sinus. It leaves the cavernous sinus to enter into superior orbital fissure, which will complete its intracranial course. Once it exits the superior orbital fissure, then begins the extracranial course of the trochlear nerve. In its extracranial course, the trochlear nerve will supply only one muscle, and that is the superior oblique. Right? During its extracranial course, the trochlear nerve will exit through the superior orbital fissure through the lateral compartment. Fine, the lateralmost compartment, and will supply what? It will supply the superior oblique muscle. This is regarding the course. Remembering the branches and area of distribution is quite easy because there is only one muscular branch, and that muscular branch is supplying what? The superior oblique muscle. Right? So this is the only branch and area of distribution that you need to remember for trochlear nerve. Right? Now what happens if trochlear nerve gets injured? Now trochlear nerve supplies superior oblique. What is the function of superior oblique? Now remember, superior oblique brings about two important functions. What are they? One is depression of the eyeball, and the other one is intorsion. Fine. So what happens when superior oblique muscle gets damaged? If you observe the position of the two eyeballs, the eyeball on the right side appears as though it has moved slightly upwards. Fine. So there is a change in the visual axis. This is because of unopposed action of superior rectus and what is one more muscle? Inferior oblique. Fine. This phenomenon is what we refer to as hypertropia. So what is hypertropia? Abnormal visual axis in which one eyeball is comparatively higher in position in the vertical axis. Fine. This results because of paralysis of superior oblique or injury to trochlear nerve. The patient will give a classic symptom of inability to see clearly when they are climbing downstairs. Right? So when they are going downstairs, they cannot actually see the structures clearly. That is what the typical clinical symptom they will present with. And this can be seen clinically as hypertropia. Now what happens is, if you ask the patient to tilt the head to the same side, fine, this hypertropia will increase. That is, the eyeball will further move upwards. Right? This is how you can confirm whether the trochlear nerve is injured or not. Now suppose if the right sided trochlear nerve is injured, my right eyeball would go slightly upwards. If I tilt my head slightly towards the right side, this rays will further go up. The eyeball will further move upwards. Now suppose if you tilt the head to the opposite side, if you observe, the positions of the eye become almost normal. Fine. For example, if I tilt the head to the left side, this abnormal side or the right sided eye will come down. This is how we can confirm for the presence or absence of trochlear nerve injury. Fine. So this is what you need to remember regarding the clinical anatomy of trochlear nerve. Right? Once we have learnt about trochlear nerve, let's focus on the last of the cranial nerve that would supply extraocular muscle, that is the abducent nerve. Abducent nerve is the sixth cranial nerve. Even though cranial nerve, this also supplies only one muscle just like the trochlear nerve. And what muscle is that? This supplies the lateral rectus. The muscle supplied by trochlear nerve is superior oblique. The muscle supplied by abducent nerve is the lateral rectus. We will learn the abducent nerve under the same headings. First, we'll focus on what type it is. Remember, even abducent nerve is an example for purely motor nerve. So, even this is a purely motor nerve. What type of functional components is present? As I said, since it's a purely motor nerve, you can rule out all four afferent components, right? Then, the three efferent components again are general somatic efferent, special visceral efferent, and general visceral efferent. Remember, abducent nerve supplies only one muscle as I mentioned, and that is lateral rectus, which is one of the extraocular muscle and that develops from cranial somites. So there is a general somatic efferent column which is present in it. Abducent nerve will supply only one muscle and hence it will not supply any muscle derived from branchial arch. So there is no special visceral efferent column. Neither will it supply any smooth muscle, cardiac muscle or glands present in head and neck region. So the only functional component that is present in abducent nerve similar to trochlear nerve is the general somatic efferent column. Right? Now what nucleus represents this? The deep or nuclear origin of abducent nerve is there is a abducent nucleus which is located in What region? The pons. This is one peculiar thing you need to remember. For oculomotor nerve and trochlear nerve, the nuclei were present in the midbrain, whereas for the abducent nerve, it is present in pons, and you just call it as abducent nucleus. One important thing that you need to remember regarding abducent nucleus is the course of the abducent nucleus is wound around by the facial nerve, right? Resulting in internal genome. Not related to the abducent nerve directly, but since we mentioned about abducent nucleus, I thought I'll mention this. Okay? So abducent nucleus is related to the internal genome of facial nerve. This is regarding the deep origin. What about the superficial origin? We discussed that the oculomotor nerve and trochlear nerve will arise from the midbrain. What about the abducent nerve? Remember, abducent nerve will arise from this area. Now, can you tell me what is this area? This area is the pontomedullary junction. Remember, abducent nerve is the most medial nerve to arise from pontomedullary junction. Laterally, we have the two roots of facial nerve, and much more laterally, we have the vestibulocochlear nerve. So, 6th, 7th and 8th cranial nerves are attached in line from medial to lateral to pontomedullary junction. This is regarding the superficial origin. Then what about the course? The course of abducent nerve again can be studied under two headings. What are they? Intracranial course and extracranial course. Right? Intracranial course begins with its attachment to ventral aspect of pontomedullary junction. So here is the beginning. As it passes from the pontomedullary junction, it is related to the anterior cerebellar artery. So it is related to anterior cerebellar artery. Then it enters through the substance of the cavernous sinus. It passes through the interior of the cavernous sinus, which is different from oculomotor nerve or trochlear nerve, which will pass through the lateral wall. And within the center of the cavernous sinus, it is related to the internal carotid artery. These are some of the important relations that you need to mention in intracranial course. The intracranial course ends with the entry of abducent nerve into the superior orbital fissure. The extracranial course begins again from exit through the superior orbital fissure. The nerve ends by supplying only one muscle, and that muscle is the lateral rectus. This is what you can remember about the course and relations of the abducent nerve. Right? What about the branches and area of distribution? Similar to trochlear nerve, it is very easy. It will give only one branch, and that branch will supply what muscle? The lateral rectus. Lateral rectus can bring about only one action, and what is that action? It can bring about abduction of the eyeball or movement of the eyeball laterally. Right? When abducent nerve gets injured, it results in a condition called as medial squint. As you can see, the affected side is the right eye, where the eyeball has moved towards the nose or inside, right? So this is medial squint. Now why this occurs? When lateral rectus is paralyzed, there is no muscle which can bring the eyeball towards lateral side. So the medial rectus has unopposed action, and that would cause the deviation of the eyeball towards the nose. So this is medial squint, and this is what will happen in the paralysis of lateral rectus muscle, which is supplied by what nerve? Abducent nerve. This is one important clinical anatomy that you need to know regarding the abducent nerve and its palsy. Right? Let's try to quickly summarize all three cranial nerves that supply extraocular muscles. The oculomotor nerve, trochlear nerve, or the abducent nerve all are examples for purely motor nerves, and hence they do not have any afferent components. Oculomotor nerve has two important functional components: general somatic efferent fibers which will supply extraocular muscles, and then general visceral efferent component through Edinger-Westphal nucleus which will supply constrictor pupillae. Oculomotor nerve and trochlear nerve both will pass through the lateral wall of the cavernous sinus, and they are related to two important blood vessels. And what are these blood vessels? The superior cerebellar artery and posterior cerebellar artery. Once they pass through the lateral wall of the cavernous sinus, they exit through superior orbital fissure. Oculomotor nerve will supply almost all muscles of the eyeball except for the lateral rectus and superior oblique. It supplies these muscles by dividing into two rami, superior and inferior. Superior ramus would supply the levator palpebrae superioris and superior rectus, whereas the inferior ramus would supply medial rectus, then inferior rectus and inferior oblique. The nerve to inferior oblique will also give a communicating branch to ciliary ganglion. This is regarding brief about the oculomotor nerve. Trochlear nerve, as it passes through the lateral wall of the cavernous sinus, it leaves the skull through the superior orbital fissure and ends by supplying only one muscle. And what is that? That is superior oblique. We discussed about some of the peculiarities of the trochlear nerve. What are these peculiarities? Trochlear nerve is the smallest of the cranial nerve. It is the only cranial nerve to arise from the dorsal aspect of the brainstem, and it is the only cranial nerve to undergo complete decussation before emerging from the brainstem. We discussed about abducent nerve. Abducent nerve has only one functional component, that is general somatic efferent, and that is similar to trochlear nerve. Even the abducent nerve will supply only one muscle, and that muscle is lateral rectus. One important thing regarding the course of the abducent nerve is it passes through the center of the cavernous sinus related to an important artery, that is internal carotid artery. The injury to any of these cranial nerves would typically result in squint, right? This is regarding the detailed anatomy of the three cranial nerves that supply the extraocular muscles. That's it for this session.